Thank you for choosing Howard County General Hospital to deliver your new baby. We know you're very excited and that you probably have some questions about what to expect when you go into labor and arrive at the hospital. Consult with the office of your doctor or midwife for guidance on pre-registration. Pre-registering may save you time on your delivery day and will allow the hospital to review your information and address any concerns in advance. We suggest that you pack a bag for the hospital by the time you're 34 weeks pregnant. Items to include are toiletries, a robe, a breastfeeding bra and breast cream if you're planning to breastfeed, underwear, a going home outfit for your baby, and the infant car seat to bring your baby home. It's a very good idea to practice using your car seat before coming to the hospital to make sure it fits in your car and that you know how to use it and tighten the straps. You can get more information about car seat safety at mdkiss.org. When you first suspect you've gone into labor, please call your doctor or midwife, and he or she will ask you several questions to determine if it's time to go to the hospital. When you arrive, if it's between 7 a.m. and 11 p.m., come directly through the front lobby. Between 11 p.m. and 7 a.m., please enter through the emergency department entrance. There are 2 spaces in the main circle in front of the hospital reserved for expectant moms. If you park in one of those spaces, the driver should come back within 15 minutes to move the car to visitor lot C. After stopping by the front desk, you will be directed to the 2nd floor, where labor and delivery, the maternal child unit, and the neonatal intensive care unit are located. Each one of these units is locked and secure, so you will need to ring the doorbell to enter. Once you enter the labor and delivery unit, please check in at the registration desk. You will be escorted to a triage room where you will put on a hospital gown and be asked for a urine sample. Your care team will place an external monitor on your belly so that they can monitor your contractions and the baby's heartbeat. Your nurse will ask about your medical and pregnancy history. You will also get a physical exam, including a vaginal exam, to determine if it's time to be admitted for labor. If you are admitted at this time, your nurse or technician will draw blood for testing and start an IV. Our labor and delivery suites are private and spacious. Each room contains a television, CD player, a comfortable seating area, and a bathroom complete with a shower and hair dryer. You are welcome to have friends and family visit. For your privacy and safety, the number of visitors is limited. Children can stay, but they must have their own adult support person with them at all times. A comfortable waiting room for guests is available just outside the labor and delivery entrance. If you choose to labor without medication or with medication that allows you to be up and moving around, your nurse can suggest things that will help, including a birthing ball, a rocking chair, a squatting bar, and the shower. We encourage you to drink clear liquids, including water and juices, which you will find in our pantry. You may also bring your own choice of clear liquids, which can be labeled and stored in the refrigerator. In the event that a cesarean section is necessary or planned, you will go to one of our state-of-the-art, fully equipped operating rooms. A full team of providers is present at all C-sections, including a neonatal nurse practitioner or pediatrician. Your labor companion may accompany you. To help your baby feel safe and warm, we encourage skin-to-skin contact as soon as possible for both vaginal and cesarean deliveries. Skin-to-skin contact is the best way to welcome your newborn and begin your bonding experience. It is also important in establishing breastfeeding and helps your baby transition to life outside the womb. An hour or so after your baby's first feeding, your nurse will take your baby over to the warmer to measure weight and length and make a footprint. Your baby will get an ID band for one wrist and one ankle and a security tag for the other ankle. You and your significant other will also get ID bands. Your baby will receive a quick health assessment, get an antibiotic ointment in his or her eyes, and a shot of vitamin K to help with blood clotting. As soon as you and your baby are stable, you will go to the maternal child unit together. The usual stay in MCU is 2 to 3 days. Each private room is equipped with a shower and other amenities to provide a home-like setting. The cabinet above the sink has towels, washcloths, gowns, and sanitary napkins for your use, and your baby's bassinet contains undershirts, blankets, and diapers. Our family-centered approach supports the bonding of mothers and babies through rooming in, so your baby will remain with you throughout your stay in the hospital instead of going to the newborn nursery, as long as both mother and baby are healthy. Your baby's team of providers will perform exams and minor procedures on your baby in your room, providing you with the chance to be a part of all aspects of your child's care. This may include daily weigh-ins, blood tests, hearing screenings, and monitoring. In some instances, the physician may need to perform a procedure that will require your infant to go to the nursery for a short period of time. Our nurses are formally trained in mother-baby care and breastfeeding and will support you in caring for your newborn. If needed, they will provide education on feeding, bathing, and diaper changes. Lactation consultants are also available to support mothers with breastfeeding. Just like labor and delivery, the maternal child unit is locked and secure. Healthy family and friends should stop at the front desk in the hospital's main lobby to get a visitor wristband. Because we want you to have plenty of time to rest and bond with your new baby, the maternal child unit encourages quiet time, but does have visiting hours from 9 a.m. to 9 p.m. Significant others are welcome 24 hours a day. Meals are included in the room charge. We even have a stork menu, a highly complimented 4-course gourmet meal for $35. Our dietary department is open from 6:30 a.m. to 6:30 p.m., and you'll have a menu to choose from. You should call about 45 minutes before you are ready to eat. The average hospital stay after having a baby is 1 to 2 days for a vaginal delivery or 3 days for a cesarean delivery. When released from the hospital, all mothers receive instructions about follow-up care at your doctor's office. We aim to have you on your way home by 10 a.m. The only thing you need to bring for your baby is a going-home outfit and the car seat you'll use to take him or her home. Some items you may need from your local drugstore when you get home include sanitary pads, witch hazel pads, a numbing spray containing benzocaine, and pain relief medication. We hope this has answered most of the questions you have about delivering at Howard County General Hospital. Thank you for joining us for this tour. We appreciate the time you've spent with us, and we look forward to seeing you soon to help bring your new baby into the world. You can find additional information online at hcgh.org/baby.